There are several medications that we're going to recommend. There'll be 4 prescriptions, several homeopathics, and some other supplements that aid in your recovery process. You'll be getting a prescription for an antibiotic that you will start after surgery, usually take it for 5 days. Pain medicine will be Percocet, one every 4 to 6 hours as needed for pain, Ativan for sleep, and Zofran for nausea. Now, the majority of our patients don't get sick in the post-op phase unless you do not eat enough before you take the antibiotic or the pain medication. Those 4 prescriptions are covered by insurance. Generics are fine for everything. The next 2 are wonderful homeopathic medications called arnica. Now, arnica, basically a big flowering plant that helps reduce bruising and swelling, comes in 6 different forms. You'll be picking up both the tablets and the cream. The tablets, typically you'll start 2 days prior to surgery, and it's usually 5 pellets under the tongue 3 times a day. They're small, they're sweet, they dissolve fairly quickly. So you'll start those 2 days before, 5 in the morning, 5 in the afternoon, and 5 in the evening. Same thing with the day before surgery. Now, the morning of surgery, you're not to eat, drink, or take anything by mouth, but bring these homeopathics with you to the aftercare because the nurses there will administer those to you. And then you'll just space them out better the day after, and you'll continue taking them until the box is empty, which is roughly about 2 weeks. The cream version, you leave yours at home, and when I see you the next day, I'll show you how thick and where I want it. You'll apply it to the surgical areas twice a day for about 7 to 10 days. Because you're having abdominal surgery, taking narcotics, and you have limited mobility, you will get constipated after surgery. So I'm going to clear you out prior to surgery. So 2 days before surgery, you're going to start taking Colaze, which is just an over-the-counter oral stool softener. 1 tablet 3 times a day, starting 2 days before surgery. Nothing the morning of surgery, but the nurses will give it to you that afternoon and evening, and you'll continue taking it the day after for about 7 to 10 days until your bowels normalize. Now here's the fun part. 2 days before surgery, somewhere between 5 to 7 p.m., you're going to use a Dulcolax suppository. You'll slide it in, and within the hour, that should help clear you out. And keep those suppositories because you may need them in the post-op phase. Now, the day before surgery, I want you to be on an all-liquid diet. Liquid meaning smoothies, shakes, jello, pudding. If you can slurp it through a straw, you can have it. So let's say you were to make a homemade chicken noodle soup, you can only have the broth unless you pureed the whole thing. And so I'm keeping you on a liquid diet the night before, and then nothing after midnight. Once they get you to the aftercare, they'll start off with smoothies, and then by dinner time, you're back to normal eating. Getting back to the Dulcolax suppository, if after 3 days of not having a bowel movement, I want you to use that suppository again, or a Fleet's enema, because the worst pain that you can have after this surgery will be constipation. So we need to make sure we stay on top of it. So whatever foods that you would normally eat that gets you going, make sure that you have those at the ready at your home. So if coffee moves you, great. Oatmeal, prune juice, anything like that, make sure you have those things at home. The next medication we recommend you're going to purchase on Amazon. It's called Heal Fast. It's a supplement that has a bunch of things in it that aid in your recovery process. Collagen, arnica, bromelain, and a bunch of other homeopathic medications. The pre-op one, you will start 5 days prior to surgery, and then the post-op one, you'll start immediately following surgery, and that one will take 10 days to complete.